New videos every day.
Hi, I'm Dr. Vanessa Fritz. I'm a naturopathic doctor and licensed acupuncturist, and I would like to talk a little bit about the subject of heartburn and the medications that are out there to treat heartburn. Heartburn is a sensation that a lot of people in this country experience. I see a lot of patients that suffer from heartburn on a regular basis. What's really interesting about heartburn is that people think, oh, it's too much stomach acid because of the feeling of that burning feeling going up your esophagus. So sometimes heartburn is due to too much stomach acid, or really sometimes it's mostly that the acid is getting up to where it shouldn't be going. The dangerous part about heartburn, apart from the fact that it feels terrible, is that when there is acid in the esophagus, it can change the lining. The cells that line the esophagus aren't meant to tolerate acid the way the stomach lining is. So over time, after repeated insults of the acid on these cells lining the esophagus, there can be some changes that happen. We call that Barrett's esophagus, and that is a precursor to having esophageal cancer. So it is important to keep acid away from the esophagus, but there's more ways to do that than just taking an antacid type of medication. One of the reasons sometimes people experience a symptom is that they might have a little bit of structural abnormality called a hiatal hernia or a paraesophageal hernia, where a little bit of the stomach is protruding above the diaphragm, and so that sphincter, or that door, if you will, that closes between the esophagus and the stomach can't close all the way. So it's not that the person has too much acid, it's that that acid can escape through that door, which normally it shouldn't, and goes up into the esophagus. Sometimes a very easy fix for this that's not an antacid, not something like Tums or a Pepcid or a proton pump inhibitor. Sometimes what we can do is give the person digestive enzymes, because when we start the process of digestion, it really begins with our eyes. So as we prepare food, start thinking about the food, start seeing how it's cooking, that gets literally your digestive juices flowing, and that prepares the stomach to receive this food. A lot of times when we eat on the run, we don't have that process that begins before we actually start eating, and we just eat while we're driving or watching TV or doing 3 other things at once, and the stomach is just not prepared for that. And the symptoms of having too little stomach acid in our stomachs are very similar to those of heartburn, which we think of as too much stomach acid. So a lot of my patients get very quick symptom relief by just taking a digestive enzyme with their food. Ideally, it would be better to take the time to prepare your food, to sit down, and even have people who say grace, or people who just sit down, and it doesn't have to be a religious thing. You can just sit down and be thankful for the meal that you're about to have and really just concentrate on that meal. That's how we're really meant to eat. We're not meant to be eating and doing and multitasking. So a little bit of apple cider vinegar before meals is also helpful. I usually prescribe it 10 to 15 minutes. The vinegar, again, just stimulates that process of those digestive juices, of that hydrochloric acid. The hydrochloric acid then also stimulates the pancreas to release its other digestive enzymes that break down proteins and fats and carbohydrates, and so on and so forth. So just by preparing the stomach a little bit that way, if you're in a rush and you're not, going home for lunch like most of us don't do anymore, that just doing a little bit of that can be enough to take away your heartburn symptoms. There's a very easy test that can be done. There's a lot of different ways to test for really, is it too much or too little stomach acid that your body is producing. But the things that I'm recommending aren't really harmful to you, so you can try them, see if they work. And that's sort of like a trial and error test that you can do. I really prefer people try this before going on medications, especially those proton pump inhibitors that work by just inhibiting the body's production of the stomach acid, because we need stomach acid. My mother actually has this problem, and her gastroenterologist told her, oh, we're not cavemen anymore. We're not eating raw foods and raw meats, so we don't need digestive enzymes anymore, which is completely false. We need these foods to digest our food. Now, if you're eating Wonder Bread all day long, well, that gets broken down very easily. And I guess in that case, if you're eating a terrible, highly refined, processed diet, he's right. You don't need a lot of digestive enzymes and hydrochloric acid to break that food down. However, for my patients that I recommend a whole foods-based and a plant-based diet, we do need these things to not only break down the food, but absorb it. Our minerals need hydrochloric acid to get absorbed by our digestion. And our B12 vitamin is one that needs hydrochloric acid in conjunction with other things to be absorbed. And so you could be eating the best diet in the world, but if you're not absorbing it because you're taking a proton pump inhibitor, well, guess what? That could lead to anemia. It could lead to, either iron deficiency anemia or B12 deficiency anemia. And we're seeing now that people that are on proton pump inhibitors for long term are having higher risks of osteoporosis and bone fractures because, again, we need calcium. We need all these other minerals for our bone health and for the rest of our health too. So it's really important to not be on these drugs for a long period of time. There is a subset of the population that does need to have their acid suppressed because of whatever structural abnormality they might have. If they're already at risk for getting esophageal cancer, well, you have to weigh the benefits versus the risks. Obviously, I don't want anybody to end up with esophageal cancer. So it can be tricky. I have a lot of patients where weighing these benefits and risks and seeing which is stronger is kind of difficult. But there's so many other things that we can do in addition to the vinegar, in addition to a digestive enzyme. And again, just depends on the patient to help quell their symptoms of heartburn without having to go on a proton pump inhibitor. I talk a lot about in my other videos about food allergies and food intolerances. But before even looking into that, some of it is just a little bit of common sense. A lot of times we say, oh, well, when I eat really spicy food, this happens. Well, guess what? Your body can't tolerate spicy food. Don't eat it. Or don't eat it in such high quantities, or don't eat it so spicy. A lot of foods that are hard to digest because they're so processed, like pizza and hot dogs and chili dogs. Again, of course, these are foods that aren't the most healthy foods. So what you need to do is not eat them. Or if you eat a little bit. Eat a real serving size, not a big old, chili dog that could feed a family of 4. So some of it is about just changing the obvious things in your diet. I'm not talking about never enjoying and splurging on a few things every now and then, but we really need to think about the foods that we ingest, because the things we do for ourselves on a daily basis, like our diet and like our lifestyle, are so important, so much more important than any supplement or any other recommendation I can give you as a naturopath. So looking at, your food choices, first of all. And if you're making healthy food choices, sometimes there are foods that just trigger the acid reflux. And so going on an elimination diet and then challenging with different foods can help you determine if one of those foods is what's causing acid reflux. Foods that are very commonly trigger foods for people are any sorts of foods with gluten in them. So any flour, any grain product that's not millet, corn, or rice will have a little bit of gluten in it. And so taking that out of your diet for 4 to 6 weeks and then eating it again after not having it in your diet and seeing if that reproduces the symptoms, that's pretty much the gold standard for any food allergy testing. Soy is another common one. Eggs are very common. Dairy is very common. And for some people, it's a combination. So sometimes it's a combination of gluten and sugar. So somebody might be able to tolerate a bowl of pasta, but not do so well when they're eating a cake or a cookie. So it can take a while to tease out what are the foods that are triggering the acid reflux. So it's not only foods that we consider unhealthy, like pizza and chili dogs, but even healthy foods that we think are healthy can be creating these reactions in your body. proton pump inhibitors, when they were designed, if you look at the inserts in the drugs such as Nexium, it's meant to be taken for 8 weeks only. Again, just to reduce that inflammation that the body's causing, help the lining of the esophagus heal, because that is very important. But most people just end up being on these drugs long term, because the second they get off of them, if they haven't made any lifestyle changes and they haven't done any investigation to the foods that are triggering their symptoms, they're just going to get the symptoms right back again. So I think going on an 8-week, if your doctor recommends Nexium, I think it's great to go on an 8-week course of it. If you absolutely have to, if all the other things fail, go on it, bring down the inflammation, help the body heal, but then you have to really investigate the cause of your symptoms and not just rely on a pill to take away the symptoms. And as a naturopath, this is sort of one of the most important things that I do, or that I try to do for my patients. And on a last note, there's just one thing about the way Tums is marketed that I can't stand. They say, oh, Tums with calcium, and so you get your source of calcium while you take a Tums. Well, that's really paradoxical, because you need the stomach acid to absorb the calcium. So you're just putting that calcium down the toilet when you take that Tums. So please don't take Tums just for calcium. Well, thank you very much for listening. My website is austinnaturalfamilymedicine.com. If you have any questions or comments, please leave them below. And if you've liked this presentation, give us a thumbs up and subscribe to our channel for more. Thank you.